Nobody warned Regan Fosse that a German Shepherd in full tactical gear would change everything about her career on a Tuesday night in February. She was charting at the nurses' station on the third floor of Crestview Regional Medical Center, Jacksonville, North Carolina, 20 minutes from the gates of Camp Lejeune, when her radio crackled at 2:47 a.m., Ambulance Bay. Multiple casualties inbound, one critical. She didn't know yet about the dog. The soldier came in first, Sergeant Liam Abbott, 29 years old, his left forearm torn open from elbow to wrist in a way that made the paramedic holding the door look away. He was pale but still talking, giving his unit number, his blood type, the name of his commanding officer, the way soldiers do when they're trying to stay present because they know if they stop talking, something in them will give out. Regan met the gurney at the elevator and took over, calling vitals to the resident running behind her, making the mental triage calculations she'd been making for 6 years without having to think about them. Abbott's pressure was dropping. He needed the OR. She was already pressing the button before anyone asked. It was the paramedic who caught her arm. "Ma'am." His voice was careful, like he was about to say something she wasn't going to want to hear. "There's also the dog." She turned. The German Shepherd lay on a separate gurney at the edge of the bay. Someone had grabbed a rolling stretcher from somewhere, with his head low and his eyes half open, and a tourniquet cinched around his left rear leg that had been applied by someone who knew exactly what they were doing. He was wearing a tactical vest, olive drab, with a small embroidered patch on the chest. His fur was matted dark with blood from somewhere above the tourniquet that the field dressing wasn't fully controlling. He didn't whimper. He just looked at Regan with that particular stillness that animals have when they've decided to trust you with everything they've got left. "His name's Flint," the paramedic said, "military working dog. He went in first on the breach, caught shrapnel meant for the sergeant." Regan looked at Sergeant Abbott, who was now 3 feet away being pushed toward the elevator by the resident. His eyes found the dog. Something in his face, this soldier who hadn't flinched when they'd cut away his sleeve to reveal what was underneath, cracked open completely. "Don't let him die," Abbott said. "It wasn't a request." She looked at Flint. He looked back at her. Regan Fosse was a registered nurse, not a veterinarian. She was on shift at a level 2 trauma center, not an animal clinic. There were 8 other patients on her floor, and she had been awake for 9 hours, and the right answer, the procedurally correct, HR-approved, hospital policy-sanctioned answer, was to call animal control, or the base vet, or literally anyone else. She went to Flint. The paramedic helped her move him to a treatment bay in the corner of the ER. Technically a supply staging area, but it had good light and a power strip, and that was enough. She'd worked through enough trauma to know what the leg needed. The dressing wasn't sealing the wound properly because of the angle of the shrapnel entry. She repacked it. She ran a line of normal saline because he was dehydrated and going into shock, and because it was the same decision she would have made for any patient bleeding in front of her. She talked to him while she worked, the same low, even tone she used with frightened patients at 3 in the morning when they'd just woken up not knowing where they were. "You did good," she told him. "You did so good. Stay with me." Flint's breathing steadied. She was monitoring his pulse, surprisingly strong actually, considering when she heard the heels on the tile. Helen Spire, Director of Nursing Standards for Crestview Regional, moved through a building the way cold fronts move through coastal Carolina. Fast, all pressure, no warmth. She was in her 60s, impeccable even at 3 in the morning, which meant someone had called her at home, and she'd taken the time to dress before driving in. That told Regan something about the nature of that call. Spire stopped in the doorway of the staging area. Her expression cycled from confusion to understanding to something flat and final. "Miss Fosse." "He's stable," Regan said without turning around. Mild shock, shrapnel wound to the left rear leg. "I've controlled the bleed. He needs surgical debridement and probably imaging, but he's not going to die in the next hour." "Miss Fosse," the voice hadn't changed. "That is a dog." "Yes. This is a hospital." "I know. We do not treat animals in this facility. That is not a gray area. That is policy. It is state regulation, and it is something you were informed of at orientation and at every annual competency review since." Regan turned around. She looked at Spire. The crossed arms, the granite posture, the complete and absolute certainty, and then she looked down at Flint, whose eyes were tracking her, whose breathing was even, who was still wearing the tactical vest with the patch that read K9 Unit USMC Semper Fidelis. "His handler is upstairs," Regan said. "In surgery. Flint went in first on the breach tonight. He took the shrapnel instead of the sergeant." "I understand that this situation feels emotionally compelling," Spire said, in the tone of someone explaining gravity to a child. "I also understand that you have made a clinical decision outside your scope of practice, without authorization, using hospital resources. That is a terminable offense, and I need you to understand that I am not speaking hypothetically." Regan's hands were still gloved. There was dried blood on her forearm, just above the glove line, where she'd reached in to repack the wound. "Are you firing me," she said, "right now, in front of this dog, because I stopped him from going into shock? I am informing you that your employment with Crestview Regional is being terminated effective immediately, pending formal review. You will surrender your badge and your access card. Security will escort you to your locker to collect your personal belongings, and then you will be asked to leave the premises." The bay was quiet except for Flint's breathing and the distant ping of an elevator somewhere above them. "Okay," Regan said. She didn't raise her voice. She didn't argue. She stripped off her gloves, found the ER tech, a young man named Obi, who had appeared in the doorway behind Spire and was watching this scene with his jaw somewhere around his chest, and gave him Flint's vitals with the same precision she gave every handoff. She told him what to watch for, when to recheck, what a decline in respiratory rate would mean at this stage. She gave those instructions as clearly and professionally as she had given every handoff in 6 years, because whatever happened to her next, Flint still needed someone watching him. Then she walked to her locker, collected her coat, her keys, her bag, her phone. Security escorted her, both of them, neither meeting her eyes. She signed the form they gave her. She handed over her badge. She walked out through the ambulance bay into the February cold at 3:31 in the morning. She sat in her car in the parking lot and did not cry. She wasn't sure yet what she felt. Mostly she thought about Flint's eyes when he looked at her, that choosing, that deliberate handing over of trust, and about Sergeant Abbott upstairs in surgery, who didn't know yet that the person he'd asked to save his dog was sitting in a parking lot with no job. She thought about calling someone, but it was almost 4 in the morning, and instead she just sat there in the dark, listening to the engine warm up, watching the fog settle low over the tree line to the east. Her phone rang at 5:18 a.m., a number she didn't recognize. She answered anyway. "Mrs. Fosse," a man's voice measured, with the particular flatness of someone accustomed to being listened to. "This is Rear Admiral Curtis Bain, 2nd Marine Expeditionary Force. I apologize for the hour. Do you have a moment?" She stared at the hospital building through her windshield. "I have several," she said. He told her that Sergeant Abbott had come out of surgery at 4:45. His first coherent question, before he asked about his arm, before he asked for water, before he asked what time it was whether Flint was alive. Someone on the surgical team had checked. Flint was alive. And in the process of relaying this information, someone had mentioned, almost in passing, why the nurse who'd kept Flint alive wasn't there to hear it. The detail had moved through the building the way things move through hospital buildings at 5 in the morning, when there's nothing else to do and everyone is exhausted, and something has happened that nobody can quite believe. By the time it reached Admiral Bain, who had been in the waiting area since 11 the previous night, because 3 of his Marines had gone in on that breach, and he was not the kind of admiral who stayed home, the story had accumulated some texture along the way, as stories do, but its center was accurate. A nurse had saved a Marine working dog, and she had been fired for it. Bain had made 2 phone calls after that. The first was to Arthur Karras, chairman of Crestview Regional's board of directors. A man who had served 20 years in the Navy before going into hospital administration, and who, when he understood the full shape of what had happened, said only, "I'll handle it," and ended the call. The second call was to Regan. "I want to be straight with you," Bain said. "The board has already reversed the termination. That decision was made 40 minutes ago. I'm not calling to negotiate anything. I'm calling because Sergeant Abbott specifically asked me to. He wanted you to hear it from someone directly, before you heard it any other way." Regan was quiet for a moment. "How is Flint?" she asked. "Stable. The base vet has been in. She says whoever repacked that wound bought him the time he needed." A pause. "She also said whoever did it clearly knew what they were doing." "I've seen a lot of bleeds," Regan said. "I expect you have." At 7:15 that morning, Regan walked back through the ambulance bay of Crestview Regional Medical Center. She hadn't gone home. She'd eaten a gas station breakfast sandwich in her car and watched the sun come up through the fog and decided there was no version of this morning where she was anywhere other than here. Admiral Bain was waiting inside, in dress uniform, with 2 members of his staff. There were also 4 nurses from the night shift who should have gone home 2 hours ago and hadn't, and Obi, who clearly had not slept at all and was holding 2 cups of coffee with the slightly unhinged energy of someone running entirely on adrenaline and a deep personal sense of justice. Bain shook her hand. He was somewhere in his late 50s, with the handshake of someone who meant what they did with their body. "Thank you," he said, "for doing the right thing." "I did what the situation called for," Regan said. "So did Flint," Bain said. "That's exactly why it matters." Helen Spire was not in the building. She had been asked, at 5:30 that morning, to meet with Arthur Karras and 2 board members, and whatever was said in that room was not shared with the staff. But her access cards stopped working at 6 a.m. Her parking spot was empty. By the following Monday, the title of Director of Nursing Standards had vanished from the hospital's organizational chart without comment or announcement. Nobody said much about it. Nobody needed to. Sergeant Abbott was moved out of the ICU by mid-morning. The surgeons had saved the arm. He would need months of physical therapy, and there was hardware now in his wrist that hadn't been there before. But he was sitting up and eating and being the kind of difficult, specific, determined patient that experienced nurses recognize immediately as someone who is going to be fine. When Regan came in to check on him, he looked up and the relief on his face was so complete it was almost difficult to look at directly. "Flint," he said. "He made it through the night," she said. "The base vet says he'll need surgery on the leg. 4 to 6 weeks off duty, but he's going to be okay." Abbott closed his eyes. When he opened them, they were wet and he didn't apologize for it. "He went in first," Abbott said. "That's always been his thing. Every door, every room, Flint goes in first. I tried to break him of it when he was young. Couldn't do it. It's just who he is." He looked at his bandaged arm, then back at Regan. "He technically outranks me, staff sergeant, so I guess he can do what he wants." Regan smiled at that, the first time she'd smiled in about 5 hours. "Then I guess I was just following protocol," she said. "Higher-ranking officer needed medical attention." Abbott laughed, which made him immediately wince, because abdominal surgery teaches you quickly to modulate your enthusiasm. Then quieter, "Thank you, I mean it." "I know you do," she said. She stayed for the rest of the morning, because there were other patients and other charts and the ordinary machinery of a hospital that doesn't stop because one extraordinary thing happened inside it. She medicated and monitored and answered call lights and did the work she had been doing for 6 years, the same work that had gotten her fired 6 hours earlier, the same work she would keep doing regardless. At noon, Obi found her in the break room eating the first real meal she'd had since dinner the day before. He set a printed page on the table without saying anything. It was a memo from Arthur Karras, distributed to all staff. It said, in the careful language of institutional communication, that Crestview Regional Medical Center recognized acts of exceptional professional judgment and that the previous night had exemplified the values the hospital aspired to hold. It said that the nursing staff's commitment to preserving life, in whatever form it presented itself, was the reason the hospital existed. It did not mention Helen Spire. It did not need to. At the bottom, handwritten on the printed page and scanned in, the kind of addition that didn't belong in official memos, that existed here because Karras had decided it needed to, was a single line. "We are grateful that Regan Fosse is part of this team." She read it twice, set it face down on the table. "You okay?" Obie asked. "Yeah," she said. "I think I am." Flint had gone through every door first because that was simply who he was. Sergeant Abbott had given his arm to something he believed in. Regan had stayed with a bleeding dog at 3 in the morning because he was there, and she was the one present, and those two facts together didn't leave room for anything else. She thought about that for a moment, about the way certain decisions don't actually feel like decisions at all, just the natural weight of being the kind of person you are. She finished her lunch, put on fresh gloves, and went back to work.